Assalamualaikum warahmatullahi wabarakatuh. My name is Ni Abdul Rahman Fahim bin Ni Omar, and for today I will be presenting my slide for MEM376 Assignment 2 Individual. The table of contents are objectives, introduction, procedures, case study and problem solving, conclusion, and lastly references. This slide is made according to the Safety and Health Act 19 or 1904. First, the objectives: to secure the safety, health, and welfare of persons at work against risks to safety or health arising out of the activities of person at work. The second one is to protect persons at a place of work other than persons at work against risks to safety or health arising out of the activities person at work. The third one, to promote an occupational environment for persons at which is adapted to their physiologies and psychological needs. And lastly is to provide the means whereby the associated occupational safety and health legislations may be progressively replaced by a system of regulations and approved industry codes of practice operating in combination with the provisions of this act designed to maintain or improve the standards of safety and health. On to the next slide. Introduction. The Occupational Safety and Health Act 1994 or Act 514 provides the legislative framework for the safety, health, and welfare among all Malaysians' workforce. The principle is to prevent and protect the workers against hazards and its risks in connection with their activities at work. It requires all companies to establish and document. Number 1, safe and health policy. Number 2, duties of the employer, employee, and the safety and health officers. The third one, the safety and health committee of companies, and the fourth one, occupational safety and health inspections and officers. Next is the procedures. The first one for employers. Develop an infectious disease preparedness and response plan. Number 2, prepare to implement basic infection prevention measures. Number 3, develop policies and procedures for prompt identification and isolation of sick people if appropriate. Fourth, develop, implement, and communicate about workplace flexibilities and protections. Last one is implement workplace controls. Next up is the employees. Wear masks or cloth face coverings at a minimum at all time when public co-workers or the general public. Frequently wash your hands with soap and water for at least 20 seconds. Avoid touching your eyes, nose, or mouth with unwashed hands. Practice good respiratory etiquette. Avoid close contact. Recognize personal risk factors. Next up is OSHA. Introducing SOP and enforcing it as it becomes the guideline for any activities during COVID-19. Enforcing standards for COVID-19 such as PPE. Providing training and manuals for employers and employees. Always raise awareness and remind people to follow the SOP. Take immediate action when receiving report on infected person and prepare to investigate and control the situation. Lastly, for procedures is notifications. Take immediate action when suspecting any COVID-19 system at workplace. Notify the medical officer or employer in case of any detected COVID-19 symptom at the workplace. And the last one, a registered medical officer must check the liability of the patient, whether they are positive or not. Next is the case study. The case study that I have chosen is happened at Kuala Lumpur on January 16, which is the company Malaysia's Top Glove Corporation. Some employees at 4 different factories tested positive for COVID-19. How many are there actually infected? There are more than 5,000 foreign workers were infected and 1 died. The impact on Malaysia, it became Malaysia's biggest cluster of the coronavirus. Problem solving. The actions taken on Top Glove is they are prosecuted in court for breaching Act 446 and can be punished up to 50,000 for each offence. Their estimated loss is around 3.6 billion, and the Top Glove action itself is actively ensuring the problems regarding cramped dormitory, forced labour and SOP negligence is investigated and taken action on. The last one is conclusion. In short, everyone plays a role in maintaining the order and in ensuring a safer and healthier environment. OSHA is vital in setting the standards and providing manuals and training to employers and employees in the as a step to prevent an outbreak and ensuring a safe workplace for everyone. Everyone should be able to analyze the impact of their own action themselves and comply with the SOP in order to protect them from being exposed to unnecessary threat to their safety and health. People should try to understand the regulations and procedure for their own good. Next is the reference. This is the references that I use in order to make this slide. And that is all from me. Thank you. Assalamualaikum.